and we have a great conversation to talk to you about right now in our medical world. There are efforts in the region to improve maternal health care in rural areas. After opening a new hospital in August, Sentara Albermarle in Elizabeth City is upgrading its services for expecting mothers and others within our community. And so joining us today, we have Dr. Zachary Wohlgemuth with Sentara Medical Group. And I'm hearing you are a legacy OBGYN within our community, both of your parents as well. So we're really excited for you to be here today. But first, tell us your connection with Sentara Medical Group, because I want to make sure people know where you work, where you operate, and then we'll get into what's happening right now.
Absolutely. So I'm Zach Wohlgemuth. I'm a OBGYN with Sentara Medical Group, practicing in Elizabeth City. I'm also the inpatient OBGYN medical director for the hospital at Sentara Albermarle in Elizabeth City.
So we were just talking about, what's going on right now in terms of these new efforts. I know there was the new hospital that was built in August, but there's a lot of new things happening within that particular medical facility to help with rural maternal health care. What are you guys doing right now that is so new and that's helping people within the community?
Yeah, it's great. We've had a steady leadership at the hospital over the last 3 to 4 years with our new president, and you read a lot about how maternal health in a variety of settings is they're closing labor and deliveries, so-called maternal deserts, and Sentara has been able to increase our presence in northeastern North Carolina and have created a midwifery model that's expanding access, but also bringing the same level of care that patients would be expecting in any city to a more rural setting, which has been great for our patients. And we've really found that that's increased the amount of patients that are no longer traveling to Virginia Beach or Norfolk or even Greenville in North Carolina, and are able to stay within our area to get care at our hospital.
Can you speak a little bit more about why that's such a big deal? I mean, when you talk about these kind of maternal health care deserts, so to speak, you just kind of spoke about the distances that at times people will have to travel. Right. Why does that become such a big deal when you are specifically talking about maternal health care?
Sure, yeah. I mean, maternal health care is always the forefront when we're talking about rural health, because women sometimes won't have the opportunity to travel an hour and a half to Norfolk General or Sentara Lee because they're in labor. And maternity morbidity and mortality, as well as perinatal morbidity and mortality, increases when you don't have access to care. If you are stopping at any hospital and they don't have labor and delivery, those providers, although they're great, may not have the experience or may not have delivered a baby since medical school or residency, versus a hospital that has 24/7 obstetricians, gynecologists, midwives. You're going to get a level of care that is the same whether you were walking into to Elizabeth City or to Norfolk or Virginia Beach.
And so you just mentioned midwife. I'm glad you kind of brought that into it, because for people who may not know, what does a midwife exactly bring to a birth experience?
Yeah, we're incredibly fortunate to have midwives. Elizabeth City had midwives in the past, and then the nature of rural health care and access did not have them for some time. And when we've started a couple years ago, the plan was to invest in midwifery services, which is a huge asset to our community. Midwifery care focuses on physiological birth. So they are primarily experts in low to moderate risk birth. They offer a collaborative effort with physicians. So when those low to moderate risk births become high risk births, they will able to either transition their care to a physician, or in our system, a lot of it is collaborative care where we're working side by side with the midwives. They provide a lot of what the community is looking for now, which is low intervention, home birth experience, but in the safety of a hospital, which is huge, decreasing risks associated with home births, but also increasing patient satisfaction by offering smaller, less interventions with medications, and also spending far more time at the bedside than sometimes physicians are able to do just by the nature of what we have to do, including covering the emergency room and surgery. We're not able to be at the bedside as much as some of our midwives are, which is a great satisfier for our patients.
Now, when we were kind of talking and getting some information ahead of this, right, from Sentara, there was this, I want to make sure I say it right, the Vinci Da Vinci robot. Am I saying that correctly?
You are, yeah, absolutely.
Okay,
yeah.
so technology is involved in all of this. How does that play a role?
Yeah, so the Da Vinci robot is not new to Sentara. It has been across multiple Sentara facilities. It is new to Albermarle, although they had it a while ago and it wasn't used as much. We've been very fortunate to get an investment from the system to put a robot in Sentara Albermarle, and from a GYN perspective, it allows us to do harder surgeries easier. It takes the risk of an open case, it makes it lower. So for big fibroid uteruses, for example, a lot of women that had enlarged uteruses may have to get a midline incision, so an open surgery, which requires them to stay an extra day in the hospital, higher risk of infection. And with the robotic capabilities, we're able to send them home usually the same day, smaller incisions, and allowing them to get the same level of care that they would get if they went to a different Sentara facility. So it's been great, not to mention it's helped in our recruiting efforts as patients are expecting the robot, as that's kind of the newest technology, but also our colleagues that are coming out of training nowadays are being trained on the robot. So they're looking for facilities that have the robot because that's what they're trained on. So if you're trained on that during your 4 or 5 year residency, you're going to want to go to a facility that has that. So to be able to offer that not only gives it our patients a greater level of care, but also allows us an edge in recruiting when we're recruiting to rural communities.
Now I have to ask you this because, you know, I just learned, again, off the top, I told you, you're a legacy in all of this. So you know, kind of born into, for I guess figurative speech here, but born into this particular career. Yeah. So you know, in talking with your parents, how much things have changed over the years. Could you just give some like context to people, just like technology, care, how much it has really advanced over the last, I don't know how far back even for your parents it would have been, right? What, maybe 50 years? Like how much have things really advanced to now that we've seen within this particular space?
Yeah, it's the physicians that are at the end of their career have probably seen the greatest advancement in medicine than a majority of the groups, because, you know, in the 80s, every surgery was done open. So big incision, you would stay the night in the hospital before, you'd stay a couple nights, 3-4 days afterwards. Early 1990s, they started laparoscopic surgery, which is what we've known for the last 20 years as minimally invasive surgery. So small incisions, using a camera, looking inside the belly, and operating with instruments. And those stays were decreasing the amount of time in the hospital. And now with the robot, I equate it to, you know, imagine you have to tie your shoes, and you were told you got to tie your shoes, but you have cast on your wrist. That's what laparoscopic surgery is like, because you don't have the articulation of your wrist when you're doing laparoscopic surgery. So the instruments are only on one plane. And so again, just imagine tying your shoes with cast on your wrist, right? It's a little bit more difficult, but you can do it. With robotic surgery, those casts come off. So when I move my hand on the robot, the head of my instrument will articulate. And so it makes a huge difference in allowing us to get harder cases done quicker, larger cases kept minimally invasive, and our patients go home the same day. So, you know, decreasing hospital admissions, risk of hospital acquired infections, decreasing blood loss. So it's been a huge advancement, and really, you know, exciting to kind of see the technology that's been coming in the last just 5 or 10 years. And now, you know, as we progress, I'm sure there'll be continued advancements with artificial intelligence as well. So it's really impressive.
Yeah, I can't imagine what we're going to see in the next 40 years with AI now involved with all of this. But it is such an important thing to note, because when we're talking about the most precious moment for families, you know, in that moment when you're talking about maternal health care, both for the child and for the mother too, to make sure that all parties involved are safe, and you're a big part in that. So we appreciate you for coming in and talking about the efforts now that are going on there in Elizabeth City. And I guess my last question to you, you know, you're based there, but it serves people from all over pretty much that general region, correct?
Yeah, you know, I think before I got there, there was kind of a moniker that we were a rural hospital. And with the new hospital being built, I really think that that's not a fair assessment of the technology that we have. You know, I would say we're a regional hospital serving rural communities, right? Because you tell me another hospital that has a rural hospital, quote unquote, that has a Da Vinci robot, right? That has brand new ORs and everything. So we really don't have I don't think it's fair to call us a rural hospital. I think we serve rural communities, and we're a regional center for those rural communities. Now, certainly there's things that we don't do just because we don't have the volume to do them all the time, right? And there's things that are better served at Norfolk General or Sentara Lee. But for maternity care, patients don't have that hour sometimes when they're in labor to get to a hospital. And so the investment with Sentara to be able to build a brand new labor and delivery, and one thing we didn't talk about was, transitioning from a labor and delivery model to a labor, delivery, recovery, and postpartum model, which is what our new model is. So a mom will come into the hospital, will labor in the same room that she delivers in, and then will stay in that room until she goes home, right?
And
so
why is that so significant, doctor?
Increasing bonding, limiting moving. It also creates a higher level of comfort for a patient to not have to move. I mean, if you think about what we do on labor and delivery, we're the only unit in the hospital where people are in the hospital, but they aren't sick, right? So they expect, and some women are sick on labor and delivery, and certainly, but we take care of a lot of healthy patients. So the expectation and the level of service that they expect is different than other aspects of the hospital. And so to be able to have a labor room that's bigger, that allows you to have more guests, comfort for your partner to spend the night, allowing you to deliver, recover, and be in that same room, albeit, whether you're there for 24, 48, 72 hours, it's just nice not to have to move from room to room, and nice to have a bigger room where you're there with your baby and, your family can visit, and it's not like you're, shoulder to shoulder with everyone. So it's a really nice experience for a lot of people.
Well, again, thank you so much for coming in and speaking about the new efforts that are taking place there at Sentara Albermarle in Elizabeth City. As you said, refer to it as a regional, right, hospital from what you all are doing now, and not just in a rural area. So thank you so much. You said to call you Dr. Zach, but we certainly appreciate Dr. Zachary Wohlgemuth coming in today, and thank you so much.
Absolutely. Thanks for having me. I appreciate it.